scid is a rare genetic disorder and is actually a group of several different diseases. There are more than 10 different documented types of scid. All types of scid are present at birth, affects 1 in 100,000 births, missing T cells. T cells are white blood cells that identify and attack invaders. Malfunctioning B cells. B cells are white blood cells that produce antibodies to fight infection. Children with scid are at a high risk of developing severe infections, and without treatment, many will die within their first year of life.
Texas, and the unfortunate life disease has brought him.
He is known only as Baby David.
In the early 1970s, an unusual boy captivated the nation.
He cannot leave his plastic bubble. Since birth, David has never touched another human being.
If a baby shows any of the following persistent symptoms within the first year of life, he or she should be evaluated for scid or other types of immune deficiency syndromes. 8 or more ear infections, 2 or more cases of pneumonia, infections that do not resolve with antibiotic treatment for 2 or more months, failure to gain weight or grow normally, infections that require blood antibiotic treatment, a family history of immune deficiency, or infant deaths due to infections. Humans normally have 46 chromosomes in each cell, divided into 23 pairs. Each chromosome provides the building blocks to a person's body. scid genes are found on X chromosomes of chromosome 19 and chromosome 20. More than half of scid cases are linked to the X chromosome passed on by the mother, which results in a mutation in the interleukin-2 receptor gamma gene, which produces the common gamma chain, activating the molecule JAK3. The mutation of JAK3 on chromosome 19 results in scid. This means that the abnormal IL receptors and pathways stop the development of the T cells that prevent identifying the invaders, as well as regulating the immune system, almost like preventing a spy or the defense force from doing their job. Another form of scid is ADA. ADA is found on chromosome 20. The ADA gene should be produced in the immune system to develop the lymphoid tissues, which defend the body against viruses and bacteria. When this is not present, scid occurs. Most of our physical characteristics are passed along from parents to children. Examples of these include the color of our eyes and hair. The DNA in our cells contains about 30,000 genes that are responsible for the characteristics that make an individual unique. scid is genetic and passed on through families through an X-linked recessive gene. The mother that is carrying the disease can produce 2 types of eggs, one containing the chromosome carrying scid and the other one containing the chromosome with the normal gene. If a sperm and egg that have scid combine, it creates a child with scid. If an egg with scid and a normal sperm combine, it creates a child carrier. Early diagnosis of scid is very rare. The average age at which babies are diagnosed with scid is just over 6 months. It is so rare that prenatal testing of a baby with no family history is probably not justified because the test is so expensive. The most effective treatment for scid is transplantation of blood-forming stem cells from the bone marrow of a healthy person. A bone marrow transplant from a tissue-matched sister or brother offers the greatest chance for curing scid. However, most patients do not have a matched sibling donor, so transplants from a parent or unrelated matched donor are often performed. One of the types of biotechnology available today is gene therapy. Gene therapy is an experimental technique that uses genes to treat or prevent disease. In the future, this technique may allow doctors to treat a disorder by inserting a gene into a patient's cells instead of using drugs or surgery. Although gene therapy is a promising treatment option for a number of diseases, the technique remains risky and is still under study to make sure that it will be safe and effective. The findings from my studies highlight the positive impact of treating scid in early life. The first step is to secure funding for widespread newborn screening tests. I'm optimistic that with funding we can work towards saving and improving the lives of scid patients while working towards the ultimate cure.